Thank you. Thank you, Martina. It's an honor and a pleasure to be here at the Vatican, as Bishop Anil said this morning, at the heart of the Vatican. And as the other bishop said, suddenly today we have realized the Vatican also has a heart. And we are so happy that we are finding the heart. And I'm here representing half the sky from India. And personally, for me, it's a dream come true. And at this time, even though Chantal keeps saying I don't like to be thanked, Chantal, thank you very much, and the Voices of Faith for making this happen. And Chantal, more than the CEO of Voices of Faith, is an inspiration. Her zest for life, her unlimited energy that we have seen in the last 5 days that we have been here at Rome and in Vatican, and her doggedness and her moving things to make sure that she gets what she wants is an inspiration, not only to us who have come here to Voices of Faith, but I'm sure for all of the women here, some of that we carry it in ourselves, and that is why we are doing what we are doing today. And thank you for that, Chantal. Chantal very clearly told me that I'm supposed to be talking about my personal journey. I've never done that before. This is the first time ever I'm talking about my personal journey. I've been only talking about my work. I see, looking back, it gave me an opportunity to see my life, and I looked back to see God's hand in every step of the way. I was born in a mixed religion family. I'm not even going to say an interfaith family. My father, Dr. Mahesh Kaushik, was an ophthalmic surgeon from the highest caste possible, a Hindu, Orthodox Brahmin from the northern state of Haryana, where they did not send the girls out of their homes. They did not send them to colleges, and they got them married very early in life. And he and his father, who was also an ophthalmic surgeon, went around India and Bhutan and Nepal and would go to the remote places and conduct eye camps. As part of that journey, they landed in the south of India, where my mother, who is Dorothy Paul, and an Anglican Christian, graduate public health nurse who was assigned to help my father and grandfather conduct the eye camp. And of course, my father went and fell in love with her and got married and got outcasted and had to decide to come to the south of India because he had a daughter. And if he went to Haryana, I would have been married, I would have been a grandmother, I would have been in Gungat, closing my face. So he decided that he wanted his daughter to be to make something out of her life. So that's why we moved to the south. I grew up with daily pujas, Hindu pujas, prayers to the various gods and goddesses of the Hindu pantheon. Every day in the morning we had the pujas. And we went to every Hindu pilgrim temple that was in India. And every Sunday, of course, we went with our mother to the church. And studied in Catholic schools throughout my life. And that gave me an acceptance of religion, of faith, of different ways of worshiping God. As I grew up, I went to college, to another great institution called Christian Medical College and Hospital, Vellore. And I guess that kind of sealed my faith and my work. That is where I chose Jesus as my Lord and Savior. Not because I was born to a Catholic mother, not because I was a Hindu, and I'm proud to say that today I can proclaim and I can be a Christian. And I'm very proud of that. My alma mater, Christian Medical College and Hospital, Vellore, the motto was not to be ministered unto, but to minister, not to serve unto, but to serve, from the Gospel of Matthew and Mark. And that kind of stayed with me throughout my life. My parents always worked with the poor, with the unreached, and I grew up seeing that. But it was as parents, you see them work. It really doesn't, you don't know how it affects growing up. But going to college and going into a missionary hospital and college made all the difference. And that is a motto that I carry all my life, and I use it in my work. After which, I got married to Bosco. From a Kaushik, I became a Bosco. I married a wonderful man, Bosco. From generations, they are devout Catholics. There are nuns and priests from their village, Pannur, in Tamil Nadu. And today, I'm here at the Vatican, being hailed as a Catholic woman. After 20 years after my graduation, my husband pushed me into doing my master's in healthcare management. As part of my master's program, I had to go into the slums, into the villages, and started talking to groups of women to basically understand what their healthcare needs were. At some level, I knew that the place that I wanted to work was in health, but health was a very complex subject, so we needed to understand. And this was a self-help group of Muslim women in Hyderabad, in the city that I come from, a slum. And I was asking them, during a healthcare emergency, what do you do? So one of the women piped up and said, one of the ladies told me, Madam, we mortgage or pawn our productive asset. So immediately I assumed the productive asset was a sewing machine, because most of the women were sewing. Or it could be a push cart where the husbands were selling vegetables or fruits on the push carts on the streets. So I asked her that. She said, no, madam. My son, who is 6 years old, I pulled him out of school, and he's working for 12 hours a day at a tea shop because I had to take a loan of 6,000 rupees, that is about $100 in today's time. And my child has to work for 12 hours a day to pay for an illness that is typhoid that his father had. And that kind of killed me, because I had my son Nishant, who was just 5, and my daughter Gitanjali was just 2. And I said, what am I doing? What am I doing living under the same sky in the same city? And another child who is just 6 years old has to work for 12 hours a day to pay off a loan, which could, for an illness, which could have been easily prevented, and if not prevented, could be easily treated. And it's not right for a young child to be working 12 hours a day. And that kind of sealed it for me. And I said that I need to do something. It's time, and I felt that that was my calling, and that was the bugle call for my life. And that's how a friend of mine, Nimish Parekh, and myself started Healing Fields Foundation. The vision of our organization is to make quality healthcare accessible and affordable to all people, especially the poor and marginalized people in India. Now let me give you some kind of statistic information to understand what it is like to work in this particular area in India. 2/3 of Indians live on less than $2 a day. According to the World Bank, 25% of the Indians fall below poverty line with just one incident of hospitalization, and that means lifelong indebtedness. 70% of illnesses are preventable. 80% of healthcare expenditures in India are out of pocket. 60% of deaths are of child deaths are due to preventable health issues. 47% of our children under 5 are underweight and malnourished. 600 million Indians defecate in the open. 80% of Indian women do not have access to sanitary napkins. This was the enormity of the problem. The easiest was to tuck my tail and run away and hide somewhere, saying that this is too overwhelming. But we decided that we needed to find a solution. And on the process of finding a solution, we set ourselves 3 rules. 3 rules for ourselves to start working in the foundation. And the first rule we set ourselves was to listen and understand to the women whom we were going to serve. The first thing we did was empty out our minds, empty out our hearts, and to go into the rural, into the urban slums, to the rural and tribal areas, where we would listen and understand what the health needs and the health priorities of the women are. The priorities that we have as educated women are way, way different than what the priorities of the poor are. So we needed to understand. And what we learned from them is, one, as anywhere in the world, women are the custodians and caretakers of the family's health. The mother cooks the food, mother runs to the hospital with her children, mother makes sure that the kids are got immunized. So it is the woman who takes care of the family's health. And women do not want health cover, that is any kind of health financing or health insurance, only for themselves. They want it for the whole family. When we offered health cover only for the women, they rejected it. Most of them do not have basic information that we take for granted on health, on nutrition, on hygiene, on sanitation, the different kind of programs that's available for all of us, because it's so easy for us to Google. Even what doctor prescribes, immediately we Google it to find out what the problems are, what are the side effects, whether we should be taking it or not. But my women do not have that luxury. Even the poorest of the poor women is willing to pay for health care, however small it is. She doesn't want it for free. She doesn't want charity. She wants it, she's willing to pay, provided they are assured of quality health care, and more importantly, that they are treated with dignity and respect. And that we found it the hard way, that they needed the dignity and respect. They didn't care for the rest of it. And that is so important. The second rule we learned and we set ourselves is to make the women we serve as our partners in problem solving. To illustrate this, let me just tell you a story. In Bihar, in one of the poorest states in India, Bihar, where we thought building toilets was our priority. And when we started on that path, we had the public health engineering department of the government come to us and say that they had built toilets and nobody was using the toilets. So we went there to find out why they were not using the toilets. And this particular place is on the banks of the sacred river Ganges. And every monsoon it gets flooded. And when it gets flooded, the poor lose their house, the poor lose their belonging. And so what did they do? Many of them were in self-help groups. They had taken micro loans to buy cattle and have cattle feed. And the cattle is the one which is giving them income. And they needed a dry place. And the dry place, of course, was the toilet with a nice cemented floor and a roof. And they converted that to store their cattle feed. So their priority was not toilet, their priority was a safe and space for the cattle feed. And therefore, what we did was, we asked our women, what do we do? Said we have to start thinking what we need to do to create a dry space before the monsoon. So through our community health facilitators whom we train, who are part of the microfinance groups that they are, one woman per village. And through them, we started talking to the village and started preparing them for the dry spaces that they would need during the monsoon, so that they can use the toilet for the purpose that it has been built. So that was something that we again learnt from the women and made them the partners today. Most of them in the monsoon can use the toilets and not have to go out. The third lesson that we learnt was partners and collaborations. We are great in collaborating with others who are working in the community. We do not believe that we should reinvent the wheel. There are so many ideas out there. We need to be able to complement each other. We need to be able to partner with each other. Again, I'll give you an example. One of the things that we did was, women need sanitary napkins. As I told you earlier, 80% of the women do not have access to sanitary napkins. Most of the women in a poor family share the cloth between the women in the family, because even the cotton cloth is difficult to find. And it is unhygienic, as most of you know. So our women started doing classes on menstrual hygiene with adolescent girls and young women. And then they said we need to create access to sanitary napkins, but we don't have too much money to pay. So we started a manual unit, manufactured. The women sold it for a commission. Now it's a semi-automatic unit, and now we will be transferring the running of the unit to the women so that they can be sustainable in their own environment. The ecosystem there would support them. The next one is we have partnered with a non-profit eye hospital, where they come and teach our women how to do vision testing. They go and do screening in the schools and in the villages and refer them to the eye hospital for treatment, where they can get access to care which was not available earlier. And this helped, they also earn an income. And today many of the women will not even fall under the below poverty line. Finally, I don't have time. Chantal has been showing her hands at the back. So I have to skip some parts of it. Finally, just to share some thoughts, just 2 weeks before I was reading the gospel, and it was all about the healing ministry. If you remember 2 weeks ago, it was all about the healing ministry. It was all about Jesus going out there. He did not ask people to come to him. He went out there healing to anybody. He included everybody. Whoever had faith came to him and healed them. And he told his apostles to go out and minister, and not to be ministered unto. And we, I think, in this room, most of us believe that we are his disciples, believe that we are his apostles. And I think it is a mission that God has given us, that Jesus has given us, that to carry out our work in whatever way. It's not necessarily just health. I've heard some awesome stories of our Sister Martha and the others who have been doing the healing that we go out and give, and to reach out. Finally, with Chantal's favorite is, there are two things that we have learned in Healing Fields Foundation. One, the seemingly impossible is possible through commitment and through prayer. And two, we women make it possible. And if all of us women in this room and elsewhere can join hands together to be able to take the work that we are doing, to be able to partner and collaborate, just imagine what a transformed world we will be leaving behind. Thank you.